Welcome to Qual-ED. This is ACEP's newest podcast series where we will be exploring new topics every week that help us examine and understand quality of emergency care. I'm Arjun Venkatesh, and I'm the host of Qual-ED. I'm chair of emergency medicine at Yale University in Connecticut. I've practiced emergency medicine for over a decade, served as a quality director, but probably most importantly, I've led the ACEP Emergency Quality Network ever since 2015. The Emergency Quality Network, also called EQUAL, has engaged over 1,500 emergency departments around the nation, as well as over 30,000 emergency clinicians in implementing quality improvement projects that have improved care across a variety of things, from improving sepsis outcomes to reducing potentially avoidable imaging, improving care for chest pain, and most recently, much work dedicated to improving the care for patients with acute strokes, as well as those with opioid use disorder. Every year, hundreds of EDs around the country sign up to be part of the Emergency Quality Network, and we support them with quality improvement tools and education. The new Qual-ED podcast series is going to bring them cutting-edge evidence and research, conversations with national experts, and the unfiltered opinions and evidence we need to improve care in our emergency departments. Every week, we will have new experts take deep dives on topics that are often clinical conundrums and controversies, like how do you dose buprenorphine for opioid use disorder now that high-dose fentanyl is out there? When do you need a CTA or an MRI for a dizzy patient or a stroke patient? We'll tackle new topics every week. Some of them will be very clinical and we'll have the guideline writers and experts out there. Other weeks, we're going to be focused on how you implement these programs if you're an operational leader, a medical director, a quality director in your ED. To do this, we'll have a breadth of visitors. We'll have clinicians on these calls. We'll have hospital leaders on these calls. We'll have ED medical directors on these calls. And we'll even have folks from the insurance industry talking about how the national landscape for payment is changing how we provide care in the emergency department. We hope that this will have a variety so that people come back week after week to learn more about how they can improve the quality of care in their ED, take a better care of their patients, and demonstrate the value of emergency medicine to the nation writ large. For those who want, we'll have CME credits available for listening to the podcast, and we're going to keep the podcast as a curated and short digest of information, 20 minutes every week, so that you can fit it into your morning commute or even into your workout. You can subscribe to Qual-ED across any platform. We'll be on SoundCloud, Spotify, Apple, Google, anywhere where you get your content now. So sign up or favorite us or select this podcast now. And starting in January, we welcome you to join us on this journey exploring the quality of emergency care.